Medical Dilemma.
Welcome back, and you're watching Medical Dilemma. Again, we'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, LifeQuest Training and Consultancy Corporation, together with their partner, Manila Workshops. Okay? Now, let's continue our discussion on death and dying. Now, the next topic is about the care of the patient while the patient is dying. And one aspect I would like to explore is the use of painkillers to alleviate pain. Okay, how is this done in practice, Dr. Cordero?
For pain management, we usually refer to a pain specialist. It's a new specialization, and it is the anesthesiologists and the neurologists who work together to alleviate the pain of the patient in terminal cases. And not only in terminal cases, but also post-surgery or chronic pain. So there's a pain clinic in the hospital where I work.
Some doctors say that the use of certain painkillers like morphine actually hastens the death of the patient, although it's very effective in alleviating pain. So,
well,
what
if
do we do in
you
this
give
case?
overdosage of morphine, it will really kill the
might.
patient.
It
It might kill the patient.
Because
will.
I've read through cases in the U.S. where they actually use large doses of morphine just to
That's
bring down,
euthanasia already.
No,
bring
not
down the
really,
pain to
Father.
very comfortable levels.
I don't think it's euthanasia, because what you want to do is to give comfort to the dying person, right? So you can give as much and it will not be harmful. On the contrary, there was a lawsuit in the States because the medication given was under too low rather. The dosage was too low, so that what happened was the patient died in pain, in suffering. So it could be the other way around. What do you think,
Well,
Father?
you have to avoid extremes, overdosage, underdosage. That's why the role of the doctor here is supposed to be that he is an expert in this. He cannot just make his decision by himself. He has to consult the gold standard in medicine. So much so that the application of morphine must be such that it is able to comfort the patient. In other words, the comfort is more important than the impending death or the hastening of death. Remember the principle of double effect. It is a principle that all doctors and all philosophers and theologians uphold. That even if it brings about some risks or dangers,
Yes.
but the beneficial effect is greater or equal to the risk, and that is double effect. That is very much
Unavoidable.
accepted. Accepted. As a matter of fact, all medical interventions follow the principle of double effect.
Okay.
Even the antibiotics, the simple antibiotics, for example, there will always be ill effects. But the fact is that the good or the beneficial effect is much greater than the evil effect, or at least equal. Double effect, yeah.
Okay,
That is
so
very
in
much
such a
accepted.
case, then using high dosages of pain alleviations would be acceptable, even though it could shorten the life of the patient.
Because here sometimes the overdoses, underdoses may be relative.
That's right. That's
Okay.
right. Yes.
That is why you have to be very good in that. No, the fact is that here, no, through the principle of double effect, you are after the comfort and that particular event in which the patient does not unnecessarily experience such pain. You are only after that. You are not after killing the person.
Yes, yes. Because also, I think not all pain should be avoided.
Yes.
So there are some pains that should
Because
be experienced.
there are patients who are who are willing to undergo painful procedures just to have a good nose or a nice lips.
But they're not
more
dying.
little tummy.
Same for
Right.
dying.
That's why they're not dying, but they
To undergo the pain.
they
Yeah.
willing to endure the pain.
You know, even in medicine, there is one principle that we have to follow. We have always to cure sometimes, relief often, but comfort always.
Cure sometimes.
Cure sometimes,
relief
relief often, comfort
Comfort always.
always.
Comfort always.
And according to Loeb's law, if what you're doing works, continue doing it. If it doesn't work, stop doing it. If it doesn't work, or if you do not know what you're doing, do not do anything at all.
Dr. Sanchez, you mentioned earlier the use of IV fluids.
Yes.
I guess it's for nutrition and hydration
Yes,
of the patient.
as far as I'm concerned, and even from the Catholic point of view, they feel that giving IV fluids is just a basic nutritional need of the patient, and you should not withhold it.
Okay.
Although, again, from the disproportionate and proportionate means, there might be a different view. Father, what do you think?
Well, we have to take into consideration that sometimes even the water or hydration or even the ventilation or anything can be extraordinary. Why? For example, if you take nutrition, food, but your system cannot anymore process it, that becomes extraordinary.
If you
Water.
treat IV,
Yeah, IV,
parenteral nutrition.
parenteral, or what? So if your system cannot take it anymore, why put it? Becomes extraordinary. One thing, however, that you cannot take away is ventilation. Because the patient always needs oxygen.
Okay, so can you elaborate on that? Isn't it when you have these machines, you're attaching it to them?
Yeah,
Or
yes.
you intubate the patient? Or
Yes, if the patient cannot breathe by him or herself, you have to attach her or him to a mechanical ventilation. So, essentially, the machine is breathing for the patient.
Right.
So, that's already extraordinary. But if that mechanical ventilation is going to cure the patient, then you cannot withdraw a cure or a
Yes,
treatment.
it helps sometimes, right?
Yes. What we are talking about is if the patient is already brain dead and still attached to a mechanical ventilation. So essentially, the patient is not breathing anymore, but the machine
Just
is
the
breathing
machine.
for the patient.
Yes.
And this is where the dilemma comes in. Shall we pull the plug?
Plug, yes.
Who's going to pull the plug? When are we going to pull the plug? So these are the cases that are consulted to the ethics committee.
All right.
I see. But yes, Father.
Well, when such things happen, one of the things again that we have to go back to the principle of extraordinary means. An extraordinary means is a procedure or an intervention that do not offer hope of substantial recovery. So any intervention that do not or does not offer substantial hope of recovery is extraordinary. In which case, even for example, the mechanical ventilator becomes extraordinary when there is no hope of substantial recovery. You can pull it out. You can disconnect it. After all, there are two things that you have to remember here. Because you are talking about a patient who is terminal. If you pull the plug, disconnect it, and the patient dies, it means that the mechanical ventilator is useless. Why? It is just sustaining, that is dystonia. After all, the person cannot breathe by himself anymore. It's useless. Suppose you pull the plug and the person is still able to survive. It's still useless. So he does not need that medical ventilator or mechanical ventilator. He's able to live by himself.
On its own.
So in both cases, useless for terminal patients.
Okay.
So there is nothing to be afraid about. There is nothing to be afraid about. Why should you be afraid about?
So in other words,
Imminent na ang death ng tao ito. All we have to do is accept the eventual
Natural death.
there is no reason for relatives to like point who is going to pull
No,
the plug.
no,
Eventually.
Well, it should
It's
really
not
be
the relative that should
pull the plug.
pull the plug, as they say. But you don't actually pull the plug. You just
can
turn
just
it
Turn
off.
off the
Point.
switch, yes.
It is the attending
Turn off.
physician's
That must do it.
responsibility.
Right.
I see.
That is why if there is an attending physician who asks any one of your relatives to can plug off, don't say, again, no, you cannot do that.
I see.
Because any medical procedure or intervention can only be done by a medical personnel.
So So turning
That's
off
the law.
the machine is
Turning
a
off the,
medical procedure.
yes,
Yes.
that's right. And at the same time, you know, in practical life,
That's abandoning the patient.
yeah,
Abandoning the
yeah,
patient.
that's right. In practical life, you know, if you know how to open something, you should know how
How
to
to
close it.
close it or end it.
If you know how to connect, you should know how to disconnect. So next time, whoever connected it, remember him. He will disconnect.
Yeah, the practice in the olden times is for the hospitals. They're afraid to unplug, something.
that's what I always hear.
And they might be blamed for the
right.
death
Right.
of the
That's right.
patient.
Yes.
But that should not be.
That's
You
not-
know.
that
But that
was
is
the
a
olden
practice,
times.
unfortunately, in some hospitals still.
Some hospitals still like that. The doctors are even afraid and ask the relatives. That is being unfair to the relatives.
Yes,
No,
imagine
that is unfair.
the guilt that the,
Yes,
the
stress,
Yeah, the
relative will.
I
killed
remember
my
one
dad.
time
Damage.
there was
Right.
this
And
boy.
knowing that they do not understand these
Yeah,
things,
they don't understand.
the nitty-gritty about it.
I remember there was this boy patient, 33 years old, was not a boy anymore. But then there was that sister who is a nun rather, and there was the mother. So I thought the sister would be the one to pull out the plug, the madre. It turned out it was the mother who was 73 years old who pulled the plug. You can just imagine the guilt, no? Maybe.
Well, the attending physician in that case abandoned the patient.
You're
in my
right.
view.
You're right. You're right.
Yeah.
And
Because
that-
that is his duty.
Yes.
He didn't know. She's afraid
In
he might
critical
be misunderstood.
situation like this, one of the things that you cannot do is to abandon the patient.
That's where
This is very
Can that
important
be a-
pala,
he
no?
will- she will come in.
Yeah, this is very important because,
Legal
as you
ground.
said, this is the practice in the olden times. I mean,
And-
and I think it's still
and even
prevailing.
still.
Yeah,
Yes,
in
some
hospitals.
hospitals,
It
especially
is
in the
not the
province.
next of kin that should pull the
It
plug.
should be
should
the
attending.
never
Never.
pala. It should be a professional. It's the attending
course.
physician.
Right.
So
Yes.
because if yung mga nanonood po, no, if that ever happens to them, they should know that is tantamount to abandoning the patient.
Right.
So it's not it shouldn't be the relative
Yeah,
or
but
the
if
next
they
of
agree,
kin.
No,
If
no,
they
no.
agree,
Even
they-
in agreement.
Like a ceremonial
Ethics
pulling
are
of the
not,
plug.
allow that.
but at
You're
least
not being
legally you're
ethically
not
responsible.
liable.
You have
I
to
think
be ethically
consent is
responsible.
overrated.
Consent
If
is
it does
overrated.
happen, can that be a legal ground to sue the doctor?
Most probably.
Yes, it can be a
I
malpractice.
don't agree with that. Also, it's
I
too
understand.
minor.
But
anyway.
it depends. But most courts, at least in the U.S., are very reluctant to charge a medical practitioner with malpractice because although the standard of care is very high, it is very hard to measure and then you'll claim injury and then proximate causation. So is the so-called negligence or alleged negligence the direct cause of the injury or death of the patient? That's a very difficult element to prove. And normally, if the physician defends his or her decision to to pull the plug, etc., or to recommend pulling the plug, normally the juries in the states are very reluctant to assign negligence on the part of find negligence on the part of the doctor.
I
You're
see.
right. You're right. Because, first, after everything has settled down and they have decided, in fact, that they have to disconnect the mechanical ventilator, why should a doctor be afraid? You have already decided. The team has already decided. The stakeholders have decided. The ethics committee have decided, or at least had advised. What is there to be afraid about? Why should doctor be afraid? But do not
Pontius
put the
Pilate.
duty, because that's not the duty of the family.
That's like washing off the hands.
Washing of the hands.
But you have to document it, the consent.
Of course, everything
Alright,
should be
alright.
And
documented. Of
always
course.
consent. If you
Yes,
have
Of course, of course.
an adult person and so many adult children, they
Yes,
should all consent.
but the attending
The
should
descent
not
of one
wash
should
his
not
hands.
I see. Now, in my readings about death and dying, I came across terms like, euthanasia, physician-assisted death. What do you say about that? What can you say about that?
Well, in the Philippines, it's illegal. We do not allow euthanasia or any assisted suicide. In fact, it's criminal. As I said, the revised penal code punishes anyone who assists or lends assistance to suicide that eventually leads to, that's tantamount to killing the person who committed suicide. And all. But nevertheless, I have a question to our doctors here. Dun sa medical respirator, in the reverse, if the family insists on keeping the patient, although extraordinarily it is already useless, can you prolong that? Can you keep the patient
Yes,
under?
of
Yes,
course.
it's an option.
You cannot refuse
It's an
that.
option. Although, it is time to educate the family because that will be dyskinesia, a necessary prolongation of the suffering process.
But sometimes they need to prolong because some of the will are not yet arranged or...
Well, in that case,
Ah,
the
that's a
relatives
really-
are not
we do
happy
understand.
Yes,
We do understand.
That's
We always
in
give
practice.
leeways because you better go to the non-controversial side. It is more non-controversial. Okay, so we cannot do euthanasia. We discourage dyskinesia. We only encourage orthothanasia.
Orthothanasia.
Orthothanasia, ortho
Natural
means
death.
right death, allowing the person to die,
Naturally.
Naturally.
putting him back to that original state of his being, of which he is a relational person.
Okay.
This connecting him to all this mechanical ventilation makes him unrelated to each other. He becomes isolated.
Isolated.
Remove it back. Remove it. And put as if though he is there dying, alive. Remember, the dying person is still alive.
Yes,
He
yes.
is not dead. Then the relational process becomes even stronger among families.
But Father, the problem is, that's why euthanasia came into being. Well, it's a Greek word, eu meaning good, and thanasia, death, a good death. So, people are afraid of
A bad
pain, dying in pain or suffering death. That's why I'll just choose to die than to suffer any pain. So,
Oh, there's so many.
And that's what they
There's so
refer
many
to
pen
as-
intervention here.
yes, I know.
Okay.
I mean,
That's
mercy
why
killing. I'd
mercy
rather...
killing not more. Cannot be.
That's euthanasia.
That's euthanasia.
Mercy killing.
Because euthanasia can be either be active or passive. Active when you commit something in order to render the person dead,
Yes.
in order that he may not suffer. Omission is not doing anything in order that the person die. Okay, so in both cases, they are all euthanasia,
Yes,
and it is
suicide.
something that we frown upon. It is murder.
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 Physician-assisted suicide is murder.
Physician-assisted suicide.
It's murder.
That's murder.
And that's important. There are two ways to assist suicide. Either you omit, you
Yes,
refuse to
and-
give medication, or you give the patient something to
Omit.
ingest
Right.
in order for him or her to speed up or to die eventually.
I see. Okay, well, we've run out of time for today's show. Maybe we can have a few parting words from each of us. Let's start with Attorney Sarah.
For all of us, for all our viewers today, no, thank you for watching. And also, very important is sinabi ng panel natin today that when it comes to pulling the plug, it's a professional responsibility, and we cannot pass on the guilt to the families. I think that's very important. So, yun lang.
Okay, Dr. Cordero.
Well, for me, I just want to remind everybody that the first right is the right to live. If there's no life, there will be no other right to speak for.
Okay, thank you, Doctor. And
And
Father
to
Jerry.
continue with that, while there is a right to live, there is no such thing as right to die. Otherwise, people will go to jail if they are going to insist such thing as right to die. If I have a right to die, I want to die, I can ask you, can you kill me?
I see.
Okay? If you don't do it, I will sue
Sue you.
you for not respecting. No such thing as right to die. No such thing. Because a right is a concept that focuses on something positive. Right to education, right to eat, right to employment. But there's no such thing as right to slap someone, right to kill someone. No such thing. No such
Okay,
thing, because it's
okay.
negative.
Yes, Dr. Sanchez.
That's the nice thing about being the last speaker. They have all said what I wanted to say. Well, anyway, I just want to advise the audience here that, it's nice to make some advance directives too. That should be a good point. Or even verbally tell your relatives or your family that this is the way you want to die.
Okay. All right. Thank you so much, everybody. The absolute truth that life is sacred cannot be denied. It is why we have the right to live, and it is also why we do not really have the right to die. And that's why we have to be more circumspect about the medical and ethical issues that surround death and dying. Thank you for watching this episode of Medical Dilemma. If you would like to send questions, comments, or suggestions, please email them to heavenlycrestproductions@gmail.com, and we will do our best to respond to all of them. Watch us again next Sunday, 6 p.m. here on GNN for another engaging discussion on Medical Dilemma. Help patients and families in crisis, be aware, and show you care. Have an enlightened week ahead of you.
Medical Dilemma